As I said earlier, when the flow of electricity away from a lid, it is always shows downward deflection. When it moves towards a lid, it is upward deflection. You see, in third end AVF it is upwards, whereas in AVL and first it is not much upward or downward. These things you should know. Now, all of you should have an ECG record. You see, this is the isoelectric line or baseline. This is the P wave. The first upward deflection is called P wave. When atria contracts, P wave is formed. Then comes the first downward deflection, Q wave, R wave, S, T. T is the resting state of the heart. And sometimes you see U wave. U wave is not common. If it comes after T wave, it is not abnormal. But if T wave is flattened and then comes the U wave, then it is abnormal. So the first downward deflection is Q wave, then comes the R wave, then after R, S and T. This is the different waves P, Q, R, S, T. Now you will see in ECG records there are some large squares and small squares. Large square is equal to 1 large square is equal to 0.2 seconds. 1 small square is equal to 0.04 seconds. For 1 second, 0.2, 0.2, 0.2, 0.2. Totally 5 large squares are there. Likewise, for 1 minute, there will be 300. Now, you should know the calculation of heart rate. This is, you should know. We have got P wave, Q wave, R wave, S wave, T wave, P wave, Q wave, R wave, ST, like that. Now, between two R waves, here 1, 2, 3 and 4 large squares are there. So calculate the number of large squares between the two R waves and divide 300 by those numbers. It gives the heart rate. Suppose there are 4 large squares. 300 divided by 4 is equal to 75 per minute is the heart rate. If there are only 3, then it is 100 per minute. If there are 5, it's 60 per minute. The distance between two R waves should always be normal, equal. If it is not equal, then the heart, we say heart is not, rhythm of the heart is not normal. This is very important. When you put the monitor, cardiac monitor, always you should see whether the distance between the R wave is normal or not. Now, what is the correct order of reading an ECG? You should see first whether there is P wave is there or not in all the 12 leads. AVR, AVL, AVF, first, second, third, V1, V2. In all that you should see whether P wave is there or not. Then QRS complex and T wave. Now there is some measurements. PR interval. PR interval is about 1 to 3 small squares. This is 0.12 seconds. It shows the distance through which the flow of electricity goes from sinoatrial node to atrioventricular node. If it is delayed, then we consider something is wrong in the right atrium. Then the duration of the QRS complex is 3 to 5 small squares, that is 0.15 seconds. Then there is you see here one ST segment. ST segment is very important from MI part. If there is ST segment elevation from the isoelectric line, we say that there is MI. If ST segment is elevated, ST segment is elevated from the baseline, you say ST elevation, and it is always suggestive of MIs. When the patient comes, if ECG is taken and if you find ST elevation, then you say ECG, then patient's party will ask you, how is our patient, sir? And you should explain in a good manners. Then after some time, patients will ask you, sir, whether the patient can be kept here or to be referred to the higher centers. Suppose after initial treatment, if ST segment starts coming to baseline, which was elevated from the isoelectric line, then when we say patient is responding to treatment, not yet fully recovered. We are doing our treatment, he is responding. Suppose in spite of your aspirin streptokinase, if the ST segment is not coming down to the baseline, then the patient is not or heparin, the patient is not responding to your treatment. Then you should say it's better it is a case better to be shifted to higher centers. After 6 hours of initial ECG, you should take one more ECG. If it is responding, then if it has responded to treatment, there will be T wave inversion. If T wave inversion has appeared, it's clearly suggestive of patient has responded very well to your initial treatment, but still you should speak like a lamp on the wall. You should say patient has responded. It is not fair to say he is already recovered from MI. When a case of MI comes to hospital, what you should do is you should give absolute bed rest, bed rest, and absolute bed rest. 3 types of rest is there. You should give absolute bed rest, oxygen, fix the monitor, put a IV line. I am saying put a IV line, not put IV fluids. Sometimes patient may be failure associated with MIs, then it will deteriorate the condition of the patient. So put a IV line, give oxygen. Okay, these are the measures you should take, and if you start reading ECGs, you will get lot of confidence. Don't lose any chance to read ECGs. Suppose if you are interested only to practice Ayurveda, it is well and good, but if you are able to give Ayurveda medicines for cardiac cases after ECG, patients will get a lot of confidence and your income will also increase. Patients will be also very happy. So I request all of my Ayush friends, I call them friends, that you should start reading ECGs. First, identify P wave, QRS complex, PR interval, QRS time, heart rate, ST segment elevation, if any. This is the correct order of reading ECG. In the coming days, I will explain some abnormal ECGs which come into in our practice. You should know whether what is the abnormality. Always, if you identify the abnormality, if you say this ECG is not normal, then it is more than sufficient in the interest of the patient. Thank you for your patient hearing. Thank you. Good night. Enjoy the day. Enjoy the life. Thank you.